Hi everyone, so now I want to talk to you about ways to cope through the process of labour. So we've already talked about anatomy, physiology and how it all works, so now it's important for you to understand how you can cope with being at home, and then I will talk to you about forms of pain relief as well. So as we've already explained before in previous videos, it's important to stay at home for as long as you possibly can to enable all of those hormone levels to work effectively. And there are things that you can do while you're at home during the early phase of labour to help that process work. The important thing is to keep your environment as calm and relaxed as possible. So to do this, keep your lighting dim. Don't have bright lights on. Try and avoid too many disturbances. So only have the people around you that you know that you want with you during the birthing process. Make your nest. So by that what we mean is make the environment comfortable and relaxed, and it's really important, as we've explained before, to stay upright and mobile and walk around as much as you possibly can. The other thing that people need that maybe don't understand is that when you're in labour, it's important to keep hydrated and it's important to keep your energy levels up, so make sure that you are eating little and often. There's absolutely no evidence to support women starving themselves or not drinking in labour, particularly in the early phase of labour. It is also very normal prior to labour starting or in the early phase of labour that women will experience quite either nausea and vomiting, or they might experience an increased level of bowel movement, because that's the body just clearing everything out, because the digestive system will start to slow down as the labour starts to establish. But hydration is important because that's what's going to keep your energy levels up. On the flip side of that, you need to make sure that because you're drinking more, that you're keeping your bladder empty. If your bladder is full during labour, what that can do, because the bladder is the only organ that does not move upwards during the pregnancy, the bladder stays here down by the baby's head. If the bladder is full, that can impede the baby's head being able to descend into the pelvis effectively. So trying to go and sit on the loo every couple of hours during the early phase of labour to try and empty your bladder is always a good idea. You can try things like TENS machines, which we'll go into in more detail shortly, and it's important that for birth partners they're starting to offer you massaging techniques and also timing your contractions, and also it's important for you to monitor the baby's movements, as we've discussed in an earlier video. And most importantly, it's really important to remember, stay calm and relaxed. Birth is a normal process, it's not necessarily a medical emergency. And if you're worried about anything, call us. We're the ones that will be able to give you the advice and the support and reassurance that everything you're experiencing is normal. And if we don't think it's normal, then we can advise you and refer you appropriately. So it will get to the point where the labour establishes, and as the labour establishes, as we've already explained, contractions will become more intense and they will start to last longer. For some women, they would like to use other forms of pain relief other than relying on what the hormones their body produces for them. So there are different types of pain relief management. There are those that have no medicine base to them, and there are those that are what we call pharmacological based. They are medicine based pain relief options. So let's start with the options that don't involve any kind of form of medication or drugs. So we've got here the TENS machine. Now the TENS machine will work particularly well in the early stage of labour, and how this works is you use 4 sticky pads on your back, as demonstrated in this picture here, and you as the woman in labour using it will have a button that you can press to control how strong this machine works. Now what it's basically doing is it is giving you continuous electrical impulses around where the pads are, which are feeding into the signals to your brain. Whenever you get a contraction, you press the button, the boost button, and that will give you stronger electrical impulses to the brain. And it's trying to interrupt the pain signal to your brain, and also it's building your own natural endorphins as time goes on. So the TENS machine is really effective, and it can be used all the way through labour, and it can be used with other forms of pain relief should you want to use them. What I would reiterate though is obviously with a TENS machine, because it's giving you electrical pulses, it is important that you don't enter the bath or a birthing pool with the TENS machine on, to avoid serious electric shock. And also with the TENS machine, for it to work effectively, it's really important that you start it right at the beginning of early labour, so it's got time to build up your own natural endorphins in your body. Water in labour, in particular deep water immersion, is something that's very, very popular for lots of women now during labour. There might be certain circumstances where, if you have got added complexities, that using a birthing pool is not advised during your labour, but it's certainly something that you can discuss as individuals with your midwives. And water immersion in labour is definitely been proven to reduce the amount of discomfort that women feel in labour, and it's certainly been proven to reduce the length of labour as well that women experience. And for the birthing pools, they can be used in all birth settings, whether that's at home, in a midwife-led birth centre, and most obstetric labour wards will have a birthing pool available as well. Again, with the water birthing pool, you can use other forms of pain relief, such as gas and air alongside it, which can double up and help with the discomfort that you're feeling. So we'll then move on to forms of pain relief which are medicine-based. The most common form of pain relief with drugs or medication is something called Entonox, or gas and air. This is 50% oxygen and 50% nitrous oxide. This is a breathable gas, and women tend to start to use gas and air when they hit established labour. And again, you can use gas and air in any setting, whether it be at home, because we would bring that to you as part of our equipment. You can use it in our birth centres, or again, they would have it available to you in the hospital settings also. And it works really well for women that are in the birth pool as an added kind of form of pain relief as the labour starts to progress. We have another alternative, which is pethidine. Now, pethidine is an injectable form of pain relief, and this is part of the opiate group of medications, so very similar to morphine. And pethidine is injected into the deep muscle, normally into the top of your leg. And because pethidine is an opiate drug, it can make you very, very drowsy. So what we wouldn't advise is that you use this in the birthing pool. If you felt like you wanted pethidine, we would advise you to get out the pool if you were in the pool to start with. The downside to pethidine is that it is a slightly longer acting form of pain relief, and once we have given it you, we can't take the effects away. It does make you feel quite drowsy. It can make you feel a little bit kind of, some women might call it a bit out of control, and it does cross the placental barrier to the baby. So when babies are born to mums that have had pethidine, some of them can be quite sleepy at the time of birth, and it can sometimes affect them being able to latch to the breast initially because they are still quite drowsy. So there's certain things to take into consideration. Pethidine takes about 2 to 4 hours to leave your system, so if you did decide to have pethidine and you didn't like the effects it was giving you, then of course it would be that 2 to 4 hours before you would start to feel that those effects were wearing off. There isn't anything we can give you to reverse it. We then move on to something called an epidural. Now, epidurals are only available in obstetric labour wards where there are anaesthetists, because it's the anaesthetist that is the professional that is able to administer epidural analgesia. And how this works is that they pop a small plastic tube into the epidural space in your spine, which you can just see here. And then that catheter feeds in some local anaesthetic, which bathes all of the nerves here in the epidural space, and it effectively numbs everything kind of downwards from where the point in the back of your spine where the epidural has been administered. So this is more of a permanent form of pain relief throughout the whole phase of labour. In many hospital settings now, you are able to control your own pain relief with epidural, because you'll be given a boost button if you need to have a top up throughout the process. What's important to understand with epidurals are that when you have had this administered, you will be able to move your legs, but you won't be able to wait there. So you would have to be in a kind of sitting position on the bed. You wouldn't be able to go on your knees. And as discussed before, it does affect the physiology of labour, because you can't get into those upright positions. Women that have epidurals, they do have an increased chance of needing an instrumental birth because of that process. However, they are very effective forms of pain relief, and there's lots of women that have epidurals that find them very, very helpful during labour, and they are particularly helpful when you're having other interventions like induction of labour, which can make things much more uncomfortable. So that's the end of the session on coping in labour and pain relief options. I'm aware this is a very brief run through of all the options available to you, so as always, please do look at other online sources of information if you want more information on them. Also speak to your midwives individually as well.